Knee replacements are one of the most successful treatments available to medical science at the moment. There's a lot of knee replacements done both in the UK and worldwide, and in general, most patients are delighted with their outcome. There is, however, a group of patients who are then not happy with the outcome. The commonest reason that I see currently is either wear or loosening of the implants that they've had for a number of years. The second commonest cause is infection. And the third commonest cause, which is the most difficult group to treat, are people who were never happy with their knee replacement. The good news is, with appropriate investigations and assessment, there is a solution available for most failed knee replacements in order to restore function and give you the knee that you were looking for when you originally went to have your knee treated.